Welcome to Study Nurse IQ. I'm Jenny. Today we're diving into IV fluid types, their uses, and how body fluid compartments and IV fluids work together, a crucial topic for every nursing student to master. The human body is about 60 to 70% water. This fluid is stored in two main compartments. Intracellular fluid. Intra means within. This is the fluid inside our cells. It makes up about 2/3 of our total body water. The majority of our fluid is here. Extracellular fluid. Extra means outside. This is the fluid outside our cells. It makes up the remaining 1/3 of our body water. The ECF is divided into three smaller areas. Intravascular fluid, the fluid inside our blood vessels, also known as plasma. Interstitial fluid, the fluid that surrounds our cells. Transcellular fluid, a small amount of fluid found in specific body cavities like the spinal column, joints, or around the heart and lungs. These fluid compartments are all interconnected and work together to maintain a balanced, homeostatic environment. They do this by constantly shifting water and electrolytes around through a process called osmosis. Understanding osmosis. Osmosis is the passive movement of water across a semi-permeable membrane. It doesn't require any energy. Think of it this way. Water moves from an area of low solute concentration to an area of high solute concentration. A solute is a solid substance, like sodium or glucose, dissolved in a liquid. The concentration of solutes in a fluid is called its osmolarity. High osmolarity, lots of solutes, less water. Low osmolarity, fewer solutes, more water. When we administer an IV fluid, its osmolarity determines how water will shift between the intracellular and extracellular spaces. The three types of IV fluids. Now let's look at the three main types of IV fluids. The key to understanding them is in their names. Iso means equal. Hypo means low. Hyper means high. Tonic tells us how the fluid affects water movement. One isotonic IV solutions. Tonicity equal to the blood plasma. How they work. There is an equal transfer of water between the fluid compartments. This means the cell size stays the same. The primary goal of isotonic fluids is to expand the extracellular fluid volume and treat dehydration. When to use. Fluid loss from vomiting or diarrhea, hypovolemic shock, or before surgery. Examples. 0.9% normal saline replaces water, sodium, and chloride. NCLEX alert. Normal saline is the only solution you can use to administer with blood transfusions. Lactated ringers contains water, sodium, potassium, chloride, calcium, and lactate. It's great for patients with metabolic acidosis because the lactate converts to bicarbonate, which helps raise the body's pH. Nursing considerations. Monitor for fluid overload, especially in patients with heart failure or kidney disease. Watch for signs like crackles in the lungs, elevated blood pressure, and swelling, edema in the extremities. Watch sodium and chloride levels, as these can increase with too much normal saline. 2 hypertonic VOR solutions. Tonicity, higher than the blood plasma. How they work. Because of the high solute concentration, water is pulled out of the cells and into the extracellular space. This causes the cells to shrink. When to use. To treat severe hyponatremia, low blood sodium, or to reduce brain swelling, cerebral edema. Examples. Saline. Dextrose 10% in water, D10W. NCLEX alert. Use these fluids with extreme caution. Nursing considerations. These fluids can cause fluid overload and pulmonary edema because they are pulling a lot of fluid into the intravascular space. Monitor blood sodium levels for signs of hypernatremia. These solutions can be damaging to tissues if they extravasate, leak outside the vein. Some hospitals require these to be given through a central line to prevent this. 3 hypotonic solutions. Tonicity, lower than the blood plasma. How they work. These fluids have a low solute concentration, so water is pulled from the extracellular space and into the cells. This causes the cells to swell and can even cause them to rupture. When to use. To treat hypernatremia, high blood sodium, and provide free water to the kidneys to help excrete waste. Examples. 0.45% normal saline NS. Dextrose 5% in water. This one is tricky. It starts out isotonic, but becomes hypotonic in the body as the cells quickly metabolize the dextrose, leaving behind only free water. Nursing considerations. Monitor for signs of cellular swelling, especially in the brain, which can lead to changes in mental status. Watch for hypotension and signs of hypovolemia. Monitor sodium levels, as these fluids can cause hyponatremia. NCLEX alert. Never give hypotonic solutions to patients with increased intracranial pressure or a risk of cerebral edema. Let's practice some NCLEX-style quiz. Question 1. A nurse is caring for a patient experiencing severe dehydration and hypovolemic shock. Which type of IV solution is the most appropriate for this patient? A. Hypertonic. Hypotonic. Isotonic. Colloids. The correct answer is C. Isotonic. Rationale. Isotonic solutions, such as normal saline or lactated ringers, are the most appropriate for treating hypovolemia and dehydration because they expand the extracellular fluid volume without causing a significant fluid shift into or out of the cells. Question 2. A patient with a sodium level of 155 mAh, hypernatremia, is ordered an IV fluid. The nurse knows that which of the following fluid types will help correct this electrolyte imbalance? A. Hypertonic saline. B. Hypotonic saline. Isotonic saline. Dextrose 5% and 0.9% normal saline. The correct answer is B. Hypotonic saline. Rationale. Hypotonic solutions have a lower solute concentration than the blood. When administered, they pull water from the extracellular space into the cells, which helps to dilute the high sodium concentration in the blood and rehydrate the cells. Question 3. The nurse is administering a hypertonic IV solution to a patient. Which of the following signs would indicate a potential complication of this therapy? A. Increased blood pressure and crackles in the lungs. B. Decreased blood pressure and dry mucous membranes. C. Normal saline infusing through a central line. D. Decreased heart rate and increased urine output. The correct answer is A. Increased blood pressure and crackles in the lungs. Rationale. A key risk of hypertonic solutions is fluid overload. Because these fluids pull a significant amount of water into the vascular space, they can lead to symptoms like an elevated blood pressure and crackles in the lungs, which indicate pulmonary edema. That's our breakdown of IV fluids. Knowing the differences between these solutions is critical for providing safe and effective care. Thanks for watching Study Nurse IQ. Follow us on YouTube at Study Nurse IQ, Nursing Made Simple.